So if you're having breast surgery, so that's an uplift or breast reduction or even a breast augmentation, then the one that I recommend is from Lipoelastic. So the one that it is this PI Super Bra from Lipoelastic. May be able to see the chart there at the bottom. It's very specific. It doesn't give any cup sizes. It's all to do with the bandwidth. So you can see it's dynamic, it changes at the shoulder, there's hooks and eyes at the front, and it comes in black and white. And using my company name, you get a 10% discount. Now, this usually fits pretty much true to size, and I tend to go onto the slightly larger size, as I don't need you to be compressed at the chest, as in across the chest, but only over the bust. If you're finding that a little bit too much, there are other bras out there. So there's one called Junlan, Junlan. It is from Amazon. It's a post-operative bra. It does up at the front with hooks and eyes and also on the shoulders. And that retails about £20, comes in black and white as well. The only thing with that is the sizing. I can't quite work out the sizing. You'll just have to judge it because it does cup sizes from say 36 to 38, chest sizes from 36 to 40, and it's still the same size, which is a medium. So it's just something just to keep an eye out. If there is, it's better than having no bra. Or start off with the PI Super Bra, best to come in with that, and then if you need to go to another bra, maybe trial that. But there are some soft bras from Marks and Spencer's. These are post-operative bras. They don't have any underwires. They've got good stitching, and they're called T-shirt bras because they're made out of that really soft cotton T-shirt material. It's best to go into those soon after having your assessment, maybe at the 6-week mark. You can go into them earlier if you're finding the PI Super Bra a little bit uncomfortable. So this is the PI Super Bra, but the thing is that people find a little bit is that it can rise up with this banding. Now that's usually if it's a little bit tight on the chest, and then the stomach sort of folds the band up onto the incision line, which is underneath the breast for the breast reduction. So I still do prefer this bra. It's very good. It is dynamic, it is soft, it's made out of cotton, and it does cover the whole of the breast. So that is the PI Super Bra. How long to wear that for? Minimum of 2 weeks. But then after that, it is up to you whether you want to go into the softer bra. Then after 6 weeks, it is trial and error with all sorts of bras. But sometimes people go for the one that looks like it's been pressed out onto a template. So it has no seams, no underwire, and these are typically found in places like Uniqlo. So bra is the most important part of it is in the first 2 weeks. So most of my breast surgery is done as a day case, apart from if you're having an implant underneath the muscle and you may need drains. So in regards to showering, if you have a uplift or a breast reduction, you've got a glued on dressing, that will stay on for 2 weeks. You can take the bra off, take the dressing gauze off. If it's a bit stuck onto the glued on dressing, just go into the shower, let it fall off, and pat dry fresh towel back into the bra. So you can do that when you're safe to do that from day 2. For a breast augmentation, you can do, it'll be a see-through transparent dressing to the base of the breast, but basically it's not to soak into the bath. That dressing also stays on for 2 weeks. When it comes to sleeping, everyone has this idea that you have to be bolt upright and not go to your side. For a breast reduction, very much so that it's to get yourself comfortable. If you're a side sleeper, try and get one of those pregnancy V pillows, and you can nestle yourself in there, which stops you turning completely onto the breast. That's especially for the first couple of weeks. Angle of the bed, again, it's to do with pillows. It's not to put you bolt upright. It's just to give you a bit more support. That's with the mastopexy as well. And if it's a breast implant, what it is mainly is that if you have quite big implants and they are shaped, then I don't want it to twist with a pendulum effect. So it's keeping that bra, so it's usually a more compressive bra, and not really to twist onto your side for at least a couple of weeks. But apart from that, again, use the V pillow, prop yourself up a little bit. but I'm not asking you to be sat bolt upright for 6 weeks. That would stop you sleeping, especially if you're a front sleeper, which obviously you're going to have to avoid, even if you're a side sleeper. Okay, hope that helps. The consultation is there to have a discussion about surgery. It doesn't necessarily mean that you have to have surgery, or it's giving you some ideas about what it is all about. So that's why the consultation is a completely separate process. Even if you have a Zoom consultation, you still have to be seen for measurements, because then it gets a bit more bespoke to your needs, especially if it's breast reduction or breast implants. You cannot do that over a Zoom. So the consultation will start off asking about what it is that you desire and maybe your goals, understanding some of your symptoms, physical and psychological. If it's for the breast, go into your breast history, then it goes into general history, looking for allergies, smoking, which is most important, and also medications. And this is where I'm going to say about Mounjaro, Wegovy and Ozempic. So all of them have quite a long half-life. Whatever happens, you need to stop those 4 weeks before your surgery. They have multiple effects, so I don't think there should be something that's called a maintenance dose, because it is not maintaining a particular body system. It's having an effect on over 8 body systems. And once you've maintained or got your weight and the Mounjaro is not really making you lose weight, it's done its job. So then it's down to diet and exercise. So a 2.5 maintenance dose, I think it shouldn't be there. It should be stop it so that your body can go back to normal. And one of the things that it starts to do once you've lost your body fat is it starts to eat away your muscle as well. So this is really important to know, that Mounjaro, Wegovy and Ozempic have to be stopped a month beforehand. Other things to be stopped: if you're on aspirin, it have to be stopped. If you are a smoker, definitely has to no smoking, no nicotine, and that includes gums, patches and vapes. I have tried doing vapes without nicotine, but there is still something in that chemical that gives you more oozing to the tissue and in the operation. So it's best not to have that. So now I say no smoking, no vapes for at least 2 to 3 weeks prior to the operation, and best not to start too quickly afterwards. When it comes to your other medication, we will discuss that. There are certain things that are best not to take. Ramipril is one, and that's purely down to your blood pressure and the anaesthetist. All other medications should be able to be taken, but just to be aware that there are some that would have to be stopped. I also say about HRT and the pill, especially if you're having an abdominoplasty, best to stop that a month beforehand, and some of the hospitals will insist on that anyway in your pre-assessment. When it comes to supplements, it's always good to have supplements, things that make you heal better, things like vitamin D, vitamin E, vitamin C, magnesium, manganese. All of these are really good, and you can get those in many of the vitamin drinks or the multivitamins. When it comes to things that are in combination that are going to be a bit of a problem, then it's ginger shots especially, too much ginger, ginseng, garlic tablets, cod liver oil tablets, oil of evening primrose, all in concentrated forms. These should be avoided prior to your operation because it makes you bleed. So all of this will be in a sheet that's entitled your surgical journey, and all of that is mentioned on this. So again, hope this helps.